Hey, good morning, everyone. My name is Mark Driscoll. I am the program manager for the Preventative Health Program with the Ohio chapter of the American Academy of Pediatrics. And I have the pleasure of kicking us off today for our discussion of the YRBS. So let me introduce some of our speakers and guests that are joining us today, and then I will let them take the mic. John Kraus is the Youth Surveys Coordinator for the Bureau of Maternal, Child, and Family Health in the Ohio Department of Health. John has been in this role since 2021, coordinating two statewide school-based surveys, the Youth Risk Behavior Survey and the Youth Tobacco Survey, and the School Health Profile Survey. John graduated from The Ohio State University with an undergraduate degree in health promotion, nutrition, and exercise science, and received his master's in public health with a specialization of social and behavioral sciences at Kent State University. We also have with us Dr. Michelle Dritz, who will be moderating questions at the end today. Dr. Dritz is an adolescent medicine physician practicing at Dayton Children's Hospital's Cornerstone Pediatrics Clinic and teaches pediatric residents at the University of Toledo virtually. Her undergraduate and medical training has brought her around the country, spanning California, New York, Missouri, and Ohio. In addition to providing care to teens and young adults in her clinic, she works with the Ohio AAP to help support pediatricians across the state improve the care and well-being of youth throughout Ohio. I'll just say one more thing for those that are on the call or joining us later. If you are applying for CME or MOC Part 2, I will send an email out after the end of this presentation, either today or tomorrow, that will give you instructions for how to apply for that. And if you have any questions throughout the discussion today, please feel free to enter them into the chat, or at the end, we'll have kind of an open discussion period. You're welcome to unmute yourself and ask questions at that point as well. Otherwise, I will let John take over and hear from him. Thank you, John.
All right, yes. Thank you, Mark. My name again is John Kraus. I am the Youth Surveys Coordinator at the Ohio Department of Health in the Bureau of Maternal, Child, and Family Health. Today, we'll be talking about the Ohio Youth Risk Behavior Survey, Youth Tobacco Survey, also known as the YRBS-YTS. So I'll give a background of what the survey is, what it entails, the questionnaire, kind of just to give you an idea of exactly what it is. And then I'll talk about how you can access YRBS-YTS results for yourself. And then we'll close out the presentation portion, going over select results from the 2023 YRBS-YTS. I'll go over more about when the YRBS-YTS is conducted, but our most recent data available is 2023, as it's conducted every odd numbered year. So we just concluded 2025, so that data is still being looked at and make sure it's representative. But yes, our most recent is 2023. And then at the very end, we'll have hopefully a good amount of time to do some question and answer and just open discussion if anyone has any questions. So yeah, I'm happy to be here and presenting on this topic. So yes, an overview of the YRBS YTS. So the YRBS YTS, we've administered at the Ohio Department of Health through a cooperative agreement with the CDC, or Centers for Disease Control and Prevention. So it's a grant fund. We receive funding from CDC to complete the YRBS YTS. We've participated since 1993, and it's part of the nationwide Youth Risk Behavior Surveillance System, also known as the YRBSS. That is the system of youth risk behavior surveys throughout the US. So it allows for us to compare our Ohio data to other states' data that conduct the YRBS, as well as the nationwide YRBS. Like I mentioned earlier, it's collected in the fall of odd-numbered years, and we began electronic administration in 2021. It's an electronic survey in 2021, 2023, and we did that again in 2025. And if schools prefer, a paper survey is we allow for paper surveys as well, but we leave it up to the school. Its parental consent is required for students to participate, and the YRBS YTS participation is optional for schools and students. So what exactly is the YRBS YTS? It's the only reliable source of representative state level health behavior data for the teen population in Ohio. So the YRBS YTS collects data on self-reported health behavior data from students in public middle schools and public high schools. In 2019, ODH, we combined the Youth Risk Behavior Survey, the YRBS, with the Ohio Youth Tobacco Survey, the YTS, to form the YRBS YTS. And the reason why we did that is because we, as you can imagine, it's a state agency, ODH. We were reaching out to schools with multiple different surveys, and that survey fatigue was definitely impacting our response rates for both surveys, the YRBS and the YTS. So to kind of cut down on the number of requests we were having to do to schools and keep our positive relationships we have with school districts, we combined the survey. As the YRBS itself did have a number of tobacco related questions on it, so combining it did make it a little easier. And roughly one third of the YRBS YTS is composed of tobacco or nicotine or electronic vapor product questions. In terms of sampling in Ohio, so we provide CDC with a list of all public middle schools and high schools in Ohio. And then we provide that list to CDC, and part of our cooperative agreement, they do provide us with a lot of support and do a good number of data analysis and sampling for us. So we receive a sample of roughly 88 public schools in Ohio, 44 middle schools, and 44 high schools. We When we receive this sample, it's up to us to contact the schools. The YRBS YTS is not mandatory, so that's one of the biggest parts of the job is trying to get schools to agree to participate. So we contact schools through calls, emails, in-person visits. We do whatever we can to request their participation. And like I mentioned, we have 44 middle schools and 44 high schools. And then the impact on class time for the YRBS YTS is actually pretty limited or minimal because depending on the school size, only 1 to 4 classrooms in the entire school will be asked to participate. And those are also randomly selected. So it's random selection from the school level down to the classroom level, with every student in each selected school having an equal chance to participate in the survey. And then I'll just go over a little more details on the sample selection. Um, in terms of, like I mentioned, it's regular public middle schools and public high schools. It excludes alternative special education and schools operated by the U.S. Department of Disabilities and schools with less than 40 students. The YRBSS, so that's the CDC nationwide system of YRBS surveys. It gets students in grades 9 through 12 in all U.S. states, DC, and also has the national survey. There are some states, I believe there's roughly 8, more or less, give or take, 8 states that do not participate in the YRBS. They have their own survey, so we cannot compare our data to theirs. But nationwide, it's grades 9 through 12, and a few select states decide to do a middle school survey. And us in Ohio, we do have middle school data available since 2019. And then but today we'll be going over just high school data for the sake of time. And I know I'd say in my experience, high school data is typically what is asked about the most. And then, like I mentioned, we have to get schools to agree to participate. And once they do, they provide us a list of classrooms. Then we use our random selection of classrooms to select which are selected to participate in the YRBS YTS. Okay. And then to protect participant privacy and meet CDC standards, the YRBS YTS only collects and reports data at the state level. We don't collect any type of identifying information at all in the survey. I know that is sometimes a complaint when we're recruiting from schools, is they ask us, will we get our own data back? And we say no, because like I mentioned earlier, only 1 to 4 classrooms in a school are likely to participate. So that data wouldn't really tell us anything for that school itself, and also that would greatly risk privacy. So again, this data that I'm talking about today does not provide county level data or school level data. It's only at the statewide level data. And then to determine if the data is representative, the CDC actually does that for us as well. They complete a non-response bias analysis on the collected data to determine if the results can be generalizable to the entire state. So their analysis makes sure that non-responding schools do not differ from responding schools in a way that might bias the data. And since 2019, we've been able to get YRBS, YTS data, which has been great because we've had trend data since 2019. But like I mentioned, we've been conducting this survey since 1993, and getting schools to agree to participate has been a challenge since I believe 2013. It's been a challenge, but definitely it's been getting more difficult lately. There's some gap years where we did not get representative data. I believe in 2015 and 2017, we don't have data, but we'll see that later as I'm going over the results. You'll see where those gap years might be. So you might be wondering what's on the questionnaire. We have a separate high school and middle school questionnaire. The When we're making the survey, there's many different CDC guidelines we have to meet. We have a 99 question maximum on both surveys. We cannot have more than 7 response options. So, like if you're asking a question, can't be more than A, B, C, D, E, F, whatever. Yeah, going down to 7. So we can only have no more than 7 response options, and only one answer is allowed per question. So there's not multiple, you can't have multiple answers per question. There's one answer for students to respond on each question. And also there's no open-ended fill in the blank questions on the YRBS YTS questionnaire as well. Before each administration year, so that's 2023, 2025, the next will be 2027. We have a questionnaire development work group that meets to develop the questionnaire. So if you have any interest in being in that work group, the next time we will meet will be January of 2020, yeah, January 2027, sorry. So that will, obviously that seems far away, but honestly it comes up pretty quickly. My email will be in this presentation. I can also put it in the chat at the end as well. But if you have any interest in being part of these questionnaire development work groups, to have input and just provide any questions that you want to add or any type of topics you want to add or provide your input on if a question can be removed or added or altered, you can please, yeah, feel free to let me know. No, we welcome anyone who has knowledge in the area of adolescent health in those work groups. So yeah, we then once we com- complete the draft questionnaire on our end, we then have to submit it for CDC to review to make sure it meets their guidelines. Some examples of topics covered on the YRBS YTS are physical activity, drug and alcohol use, adverse childhood experiences, which I'll go into more later, mental health and suicide. And one of the differences between the high school and middle school surveys are that we ask about sexual activity only on the high school survey. And some of you might be familiar with the Ohio Healthy Youth Environment Survey, also known as the OES. I wanted to make sure you know the difference because this is something we get a lot. And I want to make sure just so you can know how you can use the data for each resource. And yeah, just get a kind of breakdown. So the YRBS YTS is a Centers for Disease Control Initiatives. Like I mentioned, we get funding from CDC to collect this representative state level data. The OES is an Ohio initiative. It's been around for definitely a few years now, and it's administered by the Ohio Department of Behavioral Health, also formerly known as the Ohio Department of Mental Health and Addiction Services. They're now the Ohio Department of Behavioral Health. They manage the OES, and they are the ones that create the questionnaire and manage the data. The YRBS YTS is administered by us at the Ohio Department of Health. We get a representative statewide sample. The OES is a local sample or census. We randomly select schools and classrooms. The OES lets any school that is interested in participating can take the OES. So all schools are eligible. And then we administer every 2 years for the YRBS YTS, every odd numbered year, like I've mentioned. And then for the OES, they recruit every 2 years, the fall of even numbered years. However, any school can take the OES at any time. There's no specific time frame that it must be completed or cannot be completed. It's available annually upon request. And then the biggest difference is that we at the YRBS YTS provide statewide representative data, while the OES provides local results for schools, counties, and boards and districts. And then we partner with the OES a lot. They try to model their survey. Any questions that we have are the same. They try to make sure their questions that they have on their survey match ours if things change. So about half the items are the same as our YRBS YTS to allow the state and national comparison to the local data that the OES might collect. So after all this, you might be wondering how you can access the YRBS YTS data for yourself. One of the websites I wanted to definitely make you aware of is the Youth Online Data Analysis Tool. So that's youthonline.cdc.gov. This, I believe it has not been updated yet due to different federal changes and things going on at the federal level, but the most recent data available on there is 2021. However, they should be adding 2023 at some point, and then we're already at the 2025 data being collected and finished, so that should be there eventually as well. But the Youth Online data analysis tool is a CDC website which provides tables and charts for all states that conduct a YRBS YTS or YRBS because we're the only ones that do the YTS as well. But they provide data for all states that have representative data. So you can access YRBS that youthonline.cdc.gov. I would recommend that. There's also different tools like the YRBS Explorer. You can see, I'll give it just a few seconds, see if you want to mark down any of these websites. And the YRBS analysis tool that lets you do cross tabulations with YRBS data, which is really helpful to look for any type of um, differences between groups. So all of these websites I've listed here are really helpful. It's one of the positives of this being a CDC supported survey is that they provide these very helpful data analysis tools for us. So like I mentioned, Youth Online is probably the one that you would maybe want to look at the most as it provides tables, graphs, charts, a lot of things that you could want. And that's youthonline.cdc.gov. And then if you want our local data, um, you can also look at our youthsurveys.ohio.gov website or Ohio Youth Surveys. This is something we partnered with the Department of Behavioral Health because in Ohio, we were getting a lot of confusion regarding the OES and the YRBS, YTS, and what's the difference? How can we access the data? So Ohio Youth Surveys was a new website we developed in July of 2023. And then on our reports and insights tab, you can click on OES or the YRBS/YTS reports. And once you click on that, you can access all our reports from our previous two administrations of 2021, 2023. Once we receive our 2025 data with our fingers crossed that it's representative, we'll also put our 2025 tables and charts up there as well. And just if you're curious, the School Health Profile Survey, that's another survey that's we do in partnership with CDC that I'm in charge of coordinating. That's the survey that's a survey that collects data from principals and health teachers on the health policies and practices of their schools. So it's not a student survey, but it involves the health policies at schools. Okay. So just to give an idea of how YRBS YTS data can be used, YRBS YTS gives students an opportunity to share their voice anonymously and voluntarily. Participation brings students' experiences to light so parents, districts, and schools can provide the appropriate resources for the challenges that students may face. At the state, and we also use the YRBS YTS data as well as school districts to set and track progress towards meeting school health and health promotion program goals, support modification of school health curricula and other programs, and support public policies that promote health. and seek funding for other support or new initiatives. Like the YRBS, YTS data is used in our state health improvement plan. It's used to track progress on our goals on improving adolescent smoking and other adolescent behaviors. So we use it at the state, absolutely, but it's also a way for school districts to track uh, changes and trends in adolescent health. And then that also helps state and local agencies and school districts understand the behaviors that contribute to morbidity and mortality of Ohio middle school and high school students. And we also receive many data requests, and you are welcome to request the raw data as well. Uh, the we receive many universities, programs, state agencies, healthcare facilities, and students use YRBS YTS data to inform their research. So ODH recently received, so just an example of what we get sometimes is we received a request for YRBS YTS data from a graduate student conducting a study on the effects of school policy changes on student mental health and well-being. We've seen many different ways the data is used for research and analysis, and I'll go into it. I can go into a little more later, but you can email me if you're interested in receiving the raw data files from the YRBS YTS for any year. There's a data use agreement you would have to fill out, which then gets approved on our end, but it's typically a pretty quick approval process as long as you meet the specifics of the data use agreement. But yeah, all the data you would receive, there's no identifying information in the first place. But yeah, there's no identifying information you receive in that raw data. So this data is available for you to receive and conduct research of your own using it for all of our representative years. All right. So with that, we are going to move into the results portion of the presentation. So in this presentation, in this last part, we're just going to go over data from our high school 2023 YRBS YTS. That's our most recent available data, like I mentioned. And first, we're going to talk about adverse childhood experiences, also known as ACEs. So something that is unique for Ohio, and we really like the data we get back, is that we're one of only, I believe, 6 or 7 states in the entire US that added these 16 ACEs questions onto the questionnaire. So we added these 16 ACEs questions in, I believe, 2021. So with 2023, we're able to finally have trend data for 2 years worth, but we had trend data from 2021 and 2023, and we added these ACEs questions again in 2025. So assuming we get representative data, we should luckily have 3 years worth. So just to give an idea, just in case you aren't aware, ACEs are potentially traumatic events that occur in childhood, 0 to 17 years, such as neglect, experiencing or witnessing violence, and having a family member attempt or die by suicide. According to the CDC, adults who with 4 or more ACEs have a much higher prevalence of health risks, such as alcoholism, drug use, depression, and suicide attempts. So that's why if you see later in this presentation in the next few slides, why we have 4 or more and how these are divided out, that's just based on CDC recommendations, and also that 4 or more ACEs have a much higher prevalence of other health risks later in life. So looking at our data, hopefully you're able to see this okay. Hi, so this is looking at one of our ACEs question or just different questions we have on the questionnaire. So one question is have you ever been bullied in the previous year before taking the survey? And the first question is students who feel that they have a caring adult in their life that they can talk to if they ever need help or assistance. So Ohio high school students who have experienced 4 or more ACEs have lower rates of having a caring adult in their life, while higher rates of being bullied on school property than those who have experienced fewer ACEs. So yeah, in the previous year, that's just saying how these questions are phrased. Have they ever been bullied in the previous year and felt they have a caring adult they can talk to in the previous year? And as you can see, red is the 4 or more ACEs. The greenish color, olive color is 2 to 3 ACEs. The light blue is one ACE, and the dark blue is zero ACEs. And as you can see, with felt they have a caring adult they can talk to, 86% of students with zero ACEs believe they have a caring adult they can talk to. Similarly, 81% for students with one ACE. Going down to four or more ACEs, roughly half feel they have a caring adult they can talk to. Then moving on to being bullied in the previous year, 5% of students with zero ACEs, moving up to 35% of students who've experienced four or more ACEs have been bullied in the previous year. And we have one more slide about ACEs. And to show, so the first question we're looking to look at is feeling of sadness or hopelessness. So the question asks, have you ever felt sad or hopeless for two or more weeks in a row that you stopped doing usual activities in the previous year? And then the second question have you ever actually attempted suicide? So of Ohio high school students who've experienced four or more ACEs, they have higher rates of attempted suicide and feeling sad or hopeless than those who experienced fewer ACEs in the previous year. Looking at the sadness or hopelessness, 58% of four or more ACEs compared to the lower rates for zero ACEs, one ACE, or two to three. And then looking at attempted suicide, roughly one in five or 20% of students with four or more ACEs reported they have actually attempted suicide, while we're at 4%, 5%, and 0% for the other categories of ACEs. All right. And yeah, with the ACEs questions, since they're relatively new, we're still getting guidance and figuring out the best way to kind of format these questions and format how we present the data. And again, if you are interested in getting this data for yourself, you are more than welcome. We also have just the tables and graphs available on our website. And all of the graphs that we're about to go over, the rest of this presentation are also available on our Ohio Youth Surveys website or youthsurveys.ohio.gov. So next, we're going to talk about mental health and suicide. So this is the percentage of students who felt sad or hopeless for every day for two or more weeks in a row that they stopped doing such usual activities in the 12 months before the survey. And these are Ohio high school students. So 35% of all Ohio high school students reported this. And one trend we see in Ohio that we've noticed, and we're not just in Ohio, but also nationwide, is on a lot of our mental health data, females are significantly more likely than their male classmates to report higher on these poor mental health outcomes. So while I'll talk about any significant differences between groups as we go forward as well, on these graphs at the bottom in the smaller text, and it might be easier to see if you download these graphs for yourself later, you can see the F is greater than M at the bottom. It might be hard to see. Anytime it has on these graphs something is greater than, that means it's a statistically significant difference between groups. So with this, females are significantly more likely than their males to report this poor mental health outcome of feeling sadness or hopelessness for two or more weeks in a row that they stop doing usual activities. Roughly close to half of all Ohio high school females felt this, 45%, and still high with males at roughly one in four. So, like I said, females, as we go through this mental health and suicide, is definitely showing higher than their male classmates. But again, still looking at all the data, it's still one in four or total 35%. This is our trend data over the years. So, like I mentioned, we did have some years where we did not get data because too few schools agreed to participate. That's why in 2015 and 2017 and 2009, there's no data. That's not because a YRBS wasn't conducted. That's just because we did not get a high enough response rate. But as you can see, between the last 3 years, there's no significant change between years. We did have a slight dip from 2021 down to 35% in 2023. However, those are not significant changes. if you look at the bottom again on these graphs, if you download them for yourself, if it does say increased, like you can see at the bottom there, that means it was a significant increase from 2003 to 2023. And then it says no change 2003 to 2011, and then a significant increase from 2011 to 2023. But yeah, this is all kind of hovered around the 20s to the high 30s. But yes, the last 3 years we've kind of been a little higher than we've seen compared to the other years. And I guess last 3 years, I mean last three administrations, as it's been since 2019. And this is the students who reported that their mental health was most of the time or always not good. So this is self-reported again. This includes stress, anxiety, and depression in the 30 days before the survey. So roughly 1/3 of all Ohio high school students reported feeling that their mental health was most of the time or always not good in the previous 30 days. Again, females are significantly more likely than their male classmates at 46% compared to 20%. And between groups of other groups, you can see with grades, 11th grade being the highest, and then black students and white students were highest as well at 32% and 33%. We have 2 years of trend data because we asked this question for the first time in 2021. So no significant change between years. We had a slight increase, but again, that's not a statistically significant change. We asked again, this question is asked again in 2025, so we'll hopefully have another data point to add on to it. And I think I haven't mentioned this actually, but our 2025 data, assuming it is representative, we should be getting by early to late. I would probably say late spring and then early summer. That's typically when we get it. That depends obviously with different delays that might happen at the federal level, but that is typically when we get our data. But if you're interested, I would keep checking or how you surveys website as we definitely update that as soon as we get our data. Um, so moving on, this is our next data. This is about students who purposely hurt themselves without wanting to die in the previous year before the survey. Again, females are significantly higher than their male classmates at 32.6% compared to 14.9%. And then total for all of Ohio is 23.4%. So that's roughly 1 in 4. We don't have trend data for this one, as we asked this for the first time in 2023. Next, we're going to move on to substance use. So then these are all Ohio high school students. So there's a percentage of high school students who had at least one drink of alcohol on at least one day in the previous 30 days before the survey. So 22.9% of all Ohio high school students reported they drank alcohol in the previous 30 days. Between groups, females actually were significantly more likely than their male classmates at 26.1% compared to 19.9%. And then, as you may expect, between grades, it does increase with each grade, with 36.5 being the highest for 12th grade. And then looking at between race or ethnicity, white students significantly more likely than, I believe it's Hispanic Latino students at 10.4%, but still the highest at 25.6. Between years, you can see we have had a decrease actually since 2003, at 42.2% starting in 2003. We've had the lowest numbers we've had in the last 3 administration years at 25.9%, 22.8, and 22.9. So alcohol, we have seen a decrease since 2003 in the last 20 years. And then this is the percentage of high school students who have ever used marijuana. So that's one or more times during their life. That's 32.2% of all Ohio high school students reported ever using marijuana. Between groups, no significant differences between male or female. Between grades, 12th and 11th grade, significantly more likely than ninth grade. And then between race or ethnicity, Black students and white students were significantly more likely than Hispanic or Latino. And then still, they're both around the state average at 32 and 35.7%. We did see a jump from 2021 and up to 32.2 from 25.8. There's been some, it's kind of hovered around similar areas. We're definitely interested to see how it looks this year, 2025. But yeah, it's nothing too significant. It does say from 2003 a significant decrease, but we'll have to see how with the new changes in the state, how things have changed. I don't know why it's the top of the slide is being blocked for me, so I apologize, but there it is. The percentage of high school students who saw ads or promotions for cigarettes or other tobacco products. This is something we found interesting because this is one of the biggest jumps we saw in terms of trend. So I'll show on the next slide, but this is asking how high school students in the previous 30 days, did you see an ad or promotion for cigarette or other tobacco product one or more times? We have 80.8% of all Ohio high school students reported seeing an ad or promotion. And then the biggest thing we wanted to showcase is yes, this is the between 2021 and 2023, an almost 40% jump, up to 80.8% compared to 48.4%. So that's a significant increase from high school students seeing ads or promotions for cigarettes or other tobacco products. So yeah, that's something our tobacco program I know here at ODH is looking at and is wondering what might have contributed to that big increase being at almost half to now almost, yeah, we're at 80%. So yeah, I want to showcase this because that's the biggest change we saw from 2021 to 2023. Now moving on to safety and violence. So this is a wide range of questions that we have. So there's a percentage of high school students who did not always wear a seatbelt when riding in a car driven by someone else. So that's a big thing to note is that this is when you're riding in a car that's driven by someone else. So 54.4% of all Ohio high school students reported they did not always wear a seatbelt. Between groups, Black students were significantly more likely than both Hispanic, Latino, and white students. So that's the biggest, only significant difference between groups. And then looking at our trend data, we've actually seen an increase over the last three administration periods from 44.1% to 54.4% in 2023. This is not yet a significant increase, but we do want to note there's a 10% increase from 2019, but these numbers are lower than they were in those from 2003 to 2013. So I do want to note that. And then this is talking about the environment going to and from school. So the percentage of high school students who did not go to school because they felt unsafe at school or on their way to or from school. So 10% of all Ohio high school students reported that they did not go to school because they felt unsafe at school or on their way to or from. But then the biggest difference between groups is Black students and Hispanic Latino students are significantly more likely than white students. And then just between years, no significant change, slight increase as we asked this question for the first time in 2021. Next, we're talking more about the environment in their neighborhood. Is high school students who ever saw someone get physically attacked, beaten, or stabbed or shot in their neighborhood. 22.2% of all Ohio high school students reported seeing this. Um, Between groups, there actually is no significant differences. However, we can note the differences we see with males at 27.1% compared to females at 17.1. And then between groups, no significant differences, but yeah, you can see Black students were the highest at 26.3 compared to around 18-19% for Hispanic, Latino, or white students. No significant change in the past two administrations from 2021 to 2023, but a slight increase of 2%, but again, not a statistically significant increase. And then we do ask questions about sexual violence only on the high school survey, and these are also some of these are part of the ACEs questions. So, percent of high school students who experience sexual violence, and this is on the survey, this is defined as being forced by anyone to do sexual things such as kissing, touching, or being physically forced to have sexual intercourse that they did not want to do one or more times in the previous year. So 8.2% of all Ohio high school students reported they've experienced this. Females significantly higher than males at 11.2% compared to 5.4%. And between groups, there's only other significant difference was white students compared to black students at 9.5% compared to 2.8. And we also have trend data on this. Again, it's only 2 years, not a significant difference, slight decrease, but again, not statistically significant. And then another question we have is experiencing sexual dating violence. So this is defined as being forced by someone they were dating or going out with to do sexual things that they did not want to do one or more times in the previous year. And this is also only among students who dated or went out with someone in the previous year. So 3.7% of all Ohio high school students reported experiencing sexual dating violence. Similar to the previous question, females were significantly more likely than males at 5.7% compared to 1.8. And then we actually have had this question for a little longer. This is actually the lowest percentage it's been since 2013 when we first asked it. No significant changes from 2019 to 2023. It does say a decrease from 2013 to 2023. But yeah, we're kind of focusing on recently, no significant changes. And then we also have questions about bullying. So this is in the previous year, the percentage of high school students who were bullied on school property. So 21.9% reported ever being bullied on school property in the previous year before taking the survey. Female significantly more likely than their male classmates at 26.9% compared to 17.1. Looking at our trend data, there's not been a significant change over the years. Looking at our last three administration periods, there has been a steady increase going from 13.9 to 21.9. We also have electronically bullied. So this is being bullied through texting, Instagram, Facebook, or other social media in the previous year. Looking at our total for all Ohio high school students, 20.9% reported ever being electronically bullied. Looking at the differences, females again, significantly more likely than their male classmates at 26.7 compared to 15.3. White students reported the highest compared to Hispanic, Latino, or Black students, and that's similar as the previous question, being bullied on school property. And then we also have this trend data as well. This one actually did have a significant increase from 2011 when this was first asked, going from 14.7 to 20.9. And yeah, those were just an example of the questions we have on the survey. There are plenty more of different questions we have, and you can access any of the data we have on our website. Like I mentioned, it's youthsurveys.ohio.gov. Um, but yeah, those just sampling. Any questions anyone has?
Well, I will just step in for just a second to say thank you to John. We do have some prepared questions with Dr. Dritz, but if you have any questions, please feel free to unmute yourself or put them in the chat. We're happy to ask those as well.
Yeah, John, that was a great presentation of just, I know, the tip of the iceberg in terms of
Yes.
the data that's out there with the YRBS and YTS data. Um, any questions so far? And again, also put questions in the chat as well. While I wait to hear if there are any questions coming through, I'm going to kick us off because I have some questions as well, especially as you were presenting. I wonder, just as I think about adolescent health and adolescent behaviors. What are some of the strategies that you as a group and as a survey uses to monitor and keep up with sometimes what are pretty fastly evolving issues and behaviors that change a lot during adolescence? Like, how do you choose what you're going to ask and kind of make those changes and decide on what are going to be the questions you want to focus on?
Yeah. So with the questionnaire, there's 66 questions on the survey that CDC basically says you have to ask these. So when you think about it, then there's 99 total. We have a specific Ohio ch choice on 33 of them. When it comes to the CDC questions, they do tell us and they do change over time. They test them with students. And they also change them because they look at the previous data. If it maybe wasn't collecting what they wanted or things have changed, they do remove questions as well if the response rates are so low. Like we were asking middle school students about methamphetamine use at one point, and those rates were so low that was removed. So that's one example. Is that sometimes at the CDC level or also Ohio, if the responses are so low, like we're getting 0.9% of all Ohio high school students are reporting this, or middle school students, that could indicate that we maybe can find room for another question if it's not really collecting data that's of much use. But also in the questionnaire development work group meetings I briefly mentioned in the presentation, that is a work group of different subject matter experts from many state agencies and also local agencies. And that's why I also mentioned we're happy to involve anyone else if they want to email me to join in January of 2027. We go over each question and we go over the data from our most recent administration and we discuss if it's still collecting what we want it to collect, if it's still of interest for Ohio and other state agencies and their subject matter expertise. And we also discuss if it can be maybe worded in a different way or worded better. And then at the end of these work group meetings, we also provide an opportunity for people to provide questions they would like to ask on the survey. And we discuss if that is a subject matter that others are interested in or if it could be of use. So there's a lot that goes into it for sure in terms of we look at the data. We also get feedback from people in our questionnaire development work group. And we also are at the kind of discretion. We have to listen also to just what CDC tells us sometimes as well. So there's lots of factors, but we do have a good amount of input on the survey ourselves for sure.
Can
Hopefully that helped answer. Mhm.
can I ask, do you have any sense of the CDC changing quite a number of its parameters based on the changes that have occurred in the CDC?
The I can say the only change that we have been told, and I'm not, there's just me providing the change that I was told. No, but we were told that the transgender question, we didn't ask it in Ohio ourselves, but if there was a transgender question, that they were no longer supporting the use of that question. So that's the only thing we were told in terms of recent changes. Um, for various reasons, we never asked it at Ohio ourselves. But that would impact if that was the only impact that was provided in terms of any recent changes that happened.
Thank you. I
Hmm.
have another question. You said that your survey showed some kids didn't come to school because they were scared, to go.
Hmm.
Um, there's a lot of kids like with severe anxiety that this survey might be able to capture if they did some homeschool, kind of surveying. Has it
Hmm.
ever been discussed about how it would impact some of the percentages?
No, yeah, that's a great point, and that is definitely one of the main. When you look at the limitations of the YRBS YTS, that's one of the biggest ones that it only looks at public students. So in terms of the YRBS, we're probably honestly not gonna have incorporate additional homeschool students, as that would impact our trend data as well, adding a different group to us. However, I did want to mention we do use ourselves this data as well, the National Survey of Children's Health, if you're familiar. So the National Survey of Children's Health is a at the federal survey. I believe it's done through a bunch of different agencies like HRSA, HHS, and the Census Bureau. So that's a household survey that's actually taken by the parents of these students, and it's a random sample of any household that has a student of has a adolescent or child in it. So that the National Survey of Children's Health does collect data that's more wide ranging, and it does ask about health behaviors. However, the biggest difference is it's not self-reported, it's parent reported. But that would include homeschooled or students at private schools as well. So that I do want to mention that survey. And then yeah, and also yeah, and just in general with the YRBS, I'd be surprised if that was ever added, as it would impact the trend data. And honestly, I'm not sure how our administration procedures would differ if we added a different type of population to the sample.
Okay, thank you.
Hmm.
Yeah, that's a really good point and a question that I was having too. I mean, understandably so, the YRBS, part of what makes it really valuable from a trend perspective is that you're collecting the same kind of cohort over and over. But yeah, we're missing a whole lot of
Hmm.
people, not just those maybe that are homeschooled, but online school or like some of the, I assume we're not necessarily getting students that are maybe in the career tech programs or some of those non-traditional programs, or are those being collected? Are we capturing those students as well? And
For commute, those would not, yeah, those ones are not private schools, and those schools are not included either. I do know I was because I was this was before I was in my position, but private schools actually were at one point included in the YRBS in Ohio. However, the sample for whatever reason, they were much more likely to not want to participate. And I believe it sounds like there was a discussion with CDC, and they told us removing them would not impact our trend data. So that's why private schools were removed.
got it. I wonder, are youth involved in the work group, like in terms of um, participating in choosing the questions, or what kind of feedback do you maybe get from youth as they participate
Yes.
in the survey?
Yes, so Ohio Department of Health created a teen wellness team in 2023, I believe, and I have presented each year that it's been around. So the teen wellness team is composed of students from all over Ohio. They apply and they actually do get paid for their participation. There's webinars once a month for 2 hours, and they had to apply, and then we went through each, I was part of the process, and we went through each application. We had, I believe, I think it was 800 applications this past go around. So there was a lot of interest. So with my work, because I only have one session that I focus on the YRBS, YTS, we go over different questions. And especially in January of 2027 and this past January, we went over the questions and the changes that the adults had recommended. And it was actually pretty surprising to hear the teens say, like one of the questions we added was a social media question,
Mhm.
and all the adults were really excited about it. And then when I showed it to the students, they were saying, this is worded really terribly, or like, I don't really like this question. So hearing that feedback definitely made us give pause on that change. And we kind of went back and evaluated, because it's kind of interesting to hear their feedback. And they talk about the YRBS all the time. And also they provide their feedback on other questions. But yeah, that was just one example where what the adults were thinking, the students were thinking quite the opposite. So it was good. We get feedback from them. And yeah,
Cool.
that's a new addition we started in 2023.
Great. Any other questions from our audience? I have one more if we
Yeah.
don't. Okay.
Hmm.
Well, I wonder, just as a last question to finish us off, I wonder, what you feel like, maybe what you've seen from your experience as you've worked with this survey for the past few years, or just some guidance that you feel that how you feel that we as pediatricians or other health professionals can be using some of this data in our day-to-day work, as we see it, not only from its research perspective, but just as in some of the kind of clinical type of work that we do.
Yeah, I would say the best way would honestly be just having the data and using it and mentioning it in your work or talking to your coworkers or other people in the field, just mentioning, looking at YRBS data, I saw this. Or also, like I mentioned earlier, you can access the raw data yourselves. Now that does take obviously some, if you're familiar with like SAS or SPSS, or that does take some data analysis work, but using the YRBS data, the raw data to conduct your own research or downloading our tables and getting a better understanding of the different adolescent health behaviors that the people you might see might be impacted with, or understanding the risk factors and protective factors. So yeah, honestly, the best way for YRBS data to be supported, I would just say, is just using it, mentioning it. We're definitely in recent years, youth data, and we're seeing it in Ohio too, there's been much harder to get schools to agree to participate. And we often ask for support from community members to get schools to participate. So we're always looking for support from anyone in the community to maybe help us reach out to schools or saying we have the support of this organization in your area. So I would just say, yeah, provide letting anyone in the community or anyone you see know that you're using the data, or yeah, using it yourself to assess risk factors or prevention planning, or yeah, just we're always looking for ways for people to have the data available to them and using it. So,
Great.
John, this is Kate
yeah.
King from the Ohio Association of School Nurses, most
Hmm.
recently of Columbus City Schools. And I just want to say that um, our organization would love to work with you. I know as a school nurse, school nurses have a big impact on getting schools to allow this data. So I
Hmm.
would think that that would be an excellent. I know when I was a director, I really convinced people, schools to take this on. So school nurses have a lot of impact. So I'm just saying that, or school counselors, the people who are
Hmm.
actually at the school would be a great resource, and we'd be happy to work with you on that.
Great.
I
Yes.
think
Hmm.
I think also if you the AAP puts out like, newsletters every week for various things. And if like somebody could write up like a synopsis of like some pertinent information, a couple times a year, just to have that data resurface, have it known that it's like based on population study.
Hmm.
That would be another avenue to alert people and let us as pediatricians use that information, as because we've read it from a reliable source.
Yes, that's a good point. I do want to shout out our ODH school nursing program. They have helped us many times with um, getting participation, especially in recent years, as it's been even harder recently. So they've helped us a lot. So yes, people in the schools and school nurses, and yeah, we those have been great partners for us.
Any last questions before I send us out? I will just mention, because it was kind of hinted at, we did sort of a digest here at the AAP for this particular presentation of the 2023 results, and that will be posted alongside this webinar soon after this webinar is posted on the preventative health page. So you can take a look at that with kind of a breakdown of this information. But I do like the idea of doing it every so often as well, so I'll bring that back to my team here. Otherwise, I want to say a big thank you again to John for speaking with us today, and Dr. Ritz for being available for questions. I will be sending an email follow-up either today or tomorrow with information about how to apply for your CME or MOC Part 2 credit. And then, as always, a huge thank you to the Ohio Department of Health for sponsoring this webinar today. We hope to see you at some more in the future. Have a wonderful rest of your Tuesday. Thank you.
Thank you.